Hi there, this is Representative Joe Sosnowski, representing Winnebago and Boone County. I've got a couple guests with us. I'll turn it over to Representative Keicher if you want to introduce yourself first, and then we'll get into the program today.
Sure. I'm State Representative Jeff Keicher. I've got a portion of Boone County, as well as parts of DeKalb and King County as well. I represent the 70th District. Thank you for being with us today.
Yeah. Mayor?
Hi, this is Mayor Mike Chamberlain, City of Belvidere. I think this is an interesting exercise, and we'll look forward to making this available for other folks to view.
And Amanda?
Yeah, hi, good morning, everyone. Representative Sosnowski and Representative Keicher and Mayor Chamberlain, thanks for having me. This is Amanda Mehl. I'm the Public Health Administrator from the Boone County Health Department in Belvidere, Illinois.
Well, thanks so much for joining us, Amanda. And I think on behalf of all three of us, we just want to thank you so much for your work. I know it's extremely busy, challenging times here. But we wanted to just spend a little bit of time picking your brain a little bit about your response and activities here in Boone County, what you're seeing, and then just get your thoughts and advice for the public in general. So we're going to just have a couple questions here. And again, the mayor and other representative can join in. But one of the things we just wanted to ask you just kind of off the bat was, how is Boone County handling this? How are we looking numbers wise? I know I ran a couple numbers here and it looked like a recent stat was we had about 305 positive cases out of about 53,000 residents in Boone. So it looks like maybe we have a known positivity rate of 0.5%. But I just want to get your thoughts and take on what we're looking at here in Boone County.
Sure. So right now as a region, and I would say that this would be true for Boone County as well, we would consider ourselves to be in phase 2 of the 5 phases of Governor Pritzker and the State Health Department's Restore Illinois plan. We're definitely still seeing an acceleration in cases in not only Boone County, but the 9-county region that we call the Northern Rockford region. So we're just working really hard to monitor the increase in cases. Positivity rate is definitely a source of discussion. That's a tricky thing to monitor because it jumps around quite a bit during the acceleration phase of a pandemic such as this one. A couple weeks ago, we were at 17% at a point in time. Then we were at a little under 14. We're going to be putting out a positivity rate most likely today or tomorrow. We're trying to track that because one of the metrics to get from phase 2 to phase 3 in the governor's plan is to sustain a positivity rate under 20% for a period of time. So that's definitely a metric that we want to be as accurate as possible in. I'll be really honest, it's been a challenge without accurate scaled up testing facilities until the end of April was when we really had facilities in the Rockford area that allowed us to get hundreds of people tested a day to really have a good grasp on what the disease circulation is in our region and in our community without positive tests to compare to the overall population. It's hard to have that surveillance factor in place. So I think that now that we have locations that people can go, it's helping us to have a better sense of what's going on, but we really haven't had that for very long. So that was, I think, an unfortunate setback here locally, that there wasn't a lot that we were able to do other than work very, very hard to advocate for the region and advocate for testing facilities to come closer to us. That was a challenge because for a really long time, the only locations were in the Chicagoland area, which we all know is not readily accessible to our residents here locally.
If I can, Amanda, what would be your ideal scenario for the testing availability? Is there a certain number of testing sites or a certain volume that you'd like to see Boone County engaging in a day or a week?
Yeah, that's a really good question. So right now, I think we're doing a pretty good job getting several hundred people tested a day at the Crusader Clinic site, which is located at Auburn High School there at the school-based health center in their parking lot. We have the testing site at UIC Rockford campus, and we do have the kinks worked out. I believe, I know there was a terrible delay with test results coming back from that location for about a 10-day period, and that was a huge setback, but I know that they're testing hundreds of people a day as well. When we test a segment of the population from an epidemiological standpoint, we want to have enough testing happening that we can get just a slice of what's going on, which gives us the ability to better predict what is happening overall. I don't think we have achieved that yet, like I said, because we just got these testing facilities secured and in place, 2 weeks ago, right? And so now that we have those, it would be nice to get another couple weeks worth of really good data to really know what is our accurate positivity rate, because it is jumping around quite a bit. The other issue that we run into is the delay in not only some of these mass testing sites getting those results, but we have to remember that our healthcare providers are very busy and very bogged down. So there is sometimes a little bit of a delay in getting results back from our healthcare facilities. Sometimes we get them in batches or clumps. And then when we go back to look at the diagnosis date, it may be at any point over, the last week period of time. So there are definitely some challenges there because everybody is trying to keep up with the workload.
Could you comment, maybe Mayor, just healthcare capacity, either what you're hearing or talking about in some of your conversations as far as residents needing a hospitalization or effects on nursing homes in the area?
Okay. I'm not sure I'm the most expert to comment on this, but I will comment from what Amanda has briefed us on and what I have seen. And so here in Boone County, we do not have any COVID-19 cases at Swedish American Hospital here. It was designated as a non-COVID-19 hospital early on. We have multiple clinics and healthcare services still available here. I think the biggest issue that we have is we've seen in our senior population, particularly in one of our nursing homes, a real hot spot. And I think that's been addressed and is continuing to be addressed through the health department. They're going to test everybody, all the residents, and all of the employees to get a better handle on it. The company, Symphony, has an onboard epidemiologist that is focusing on issues. I think in terms of our ability to deal with cases, I think we're doing quite well in that respect. You never want to see anybody die from this, certainly, but I think that the identified population, 65 and older, and particularly those with underlying conditions, are the most at risk, and those are the ones that we're trying to address. I agree with Amanda that the whole testing thing is kind of ephemeral in a way. Amanda made the comment a few weeks ago that there were probably 1,000 positive tests in Boone County out of our 54,000, but to get them tested has been a real challenge. And just because somebody tests positive doesn't mean they're going to actually get really sick. What it does mean is that they can transmit the virus to someone else. And I guess that's the thing that I don't know how we get a handle on that. I will just share with you, my wife takes my temperature every morning before I leave for the office, and we've been fine. But, I think it's incumbent upon people in my age group to take a little personal responsibility for their health as we try to do. And I think Amanda and the health department have handled our hotspots and our outbreaks best as they could. And we have plenty of PPE right now. So I think we're in an okay place. Would you agree with that, Amanda? Are there needs that we have that I didn't talk about?
No, I think that's pretty accurate, Mayor Mike. It's really hard. You can't take the number of positive tests that we have in Boone County and compare it to the overall population, because there haven't been enough tests performed. And really the way that we calculate positivity is positive test results to negative test results coming back at any point in time. And that has been a challenge for the entire region. I think we're finally there. Do I wish we had that available 6 to 8 weeks ago in our region? Absolutely. I can say with certainty that would have made the process here for our constituents and for our communities a lot easier. There's sometimes challenges at the local level getting exactly what we need to do the work that we truly believe we need to do. And I think that we try really, really hard, and we have some successes, and then we run into some roadblocks. As far as our long-term care facilities, we do have 2 that are in outbreak status right now. Symphony Northwoods has been in outbreak status since April 10th, and then just this past week, unfortunately, we had to announce our second area of concern, which is our facility, Park Place. I would agree with the mayor that both of these facilities are following our guidelines absolutely 100% the way that we're asking them to. They're stepping up and taking all the necessary measures that they need to take. COVID-19 being a novel virus is a very tricky disease to get our arms around. Every time we think that we are getting a better handle on it, we learn something new about it. So for example, the growing list of symptoms, right? So originally we felt, you know, at the worldwide level and then at the national level that we were dealing with temperature and upper respiratory symptoms, right? Cough and a shortness of breath. Well, that list has expanded now to, you know, 10 plus symptoms. We have many, many people, as the mayor alluded to, who are asymptomatic, who are feeling fine. And unfortunately, the way that COVID-19 gets into a facility is through an asymptomatic healthcare worker, you know, by no fault of their own, by no intention to bring it into the facility. They feel fine. They're not displaying any of the classic symptoms. They report to work, and they are caring for patients who are in a vulnerable status. And that's generally how it's getting into a facility. So that's a huge challenge for us, but both of our facilities have been working around the clock to assist us. I would also say that another thing that is hard to measure is prevention, right? So we can report out the sad number of resident deaths, which is tragic. Those are members of our community that we don't want to lose, right? We can report out the number of, you know, sick staff members, but we don't have an accurate picture of how many lives we have saved, how many people we have prevented from getting sick. Prevention is one of the trickiest things to measure and report out. And that's why it's hard in public health to say, you know, we've been so successful here, there, and everywhere, because a lot of the things that we do have invisible results, right? We can't necessarily put a number on prevention.
Yeah, I appreciate that. As a follow-up, you know, nationally, well, worldwide, a lot of our response and protocols have been in regard to hospital space, you know, not wanting to oversurge the system. I think what we've seen generally in the Northwest region that we're a part of, we've met those benchmarks. Are you hearing the same thing as far as hospital capacity is good, ICU capacity is good? What's kind of what you're hearing in the field?
So what I'm hearing from our 3 regional hospital systems, so Swedish American, a division of UW, Mercy Health, and then OSF, right? We're hearing from them that they are seeing an increase in usage of hospital beds for COVID patients, usage of ICU beds, and then usage of ventilators. We are not at capacity. We are not nearing capacity right now, but we are on the increase. I have not heard that we have plateaued at any of those facilities, and I have not heard that we are decreasing. So I think right now we're achieving what we need to have the appropriate health care for the residents in Winnebago, Boone, and other surrounding counties. But that's a really delicate balance, right? We don't want to ease up on social distancing and then all of a sudden have a spike or a surge, have a bunch of people that need a ventilator at the same time, and put our healthcare facilities in a position where they, in the emergency room, would literally have to make the decision between John Q. Public from Boone County and Jane Q. Public from Boone County, which one's going to get a ventilator and which one won't, because there aren't enough available. So we've got some room right now from everything I'm hearing, but I am aware that our hospitals are in their surge phases and that they have activated their incident command teams and that they're working very closely with each other to monitor that situation. That's the general response that I'm hearing from our regional hospitals.
I can ask, so kind of along those lines, what's the health department's recommendation to the general public that they do to protect themselves during this when they're out and about, and so that they don't wind up in those situations?
Yeah, so really the general things that we are recommending, I mean, it's going to sound probably like a repeat to many folks, but a lot of it is just pretty basic stuff. So, washing our hands really well with warm soapy water for at least 20 seconds, singing happy birthday or twinkle twinkle little star. I say that a lot and it always makes me laugh because it seems like something so basic that we all learned in kindergarten, right? But many people do not wash their hands adequately. Having hand sanitizer readily available when you leave the house, I know that that's a hard thing to abide by too, because there haven't been, stocked shelves full of hand sanitizer now for months. That's just a really basic thing. We would really ask the public to continue to stay at home and shelter in place as much as possible, to leave home for essential services only, to send one, maybe two members of the household, not the whole family, out for an outing to the grocery store or the gas station. Wearing a mask is recommended now. I know that that was not the original recommendation from the World Health Organization and the CDC, but the reason for the mask is to keep the air that comes out of our mouths from spreading to other people. So it's more about what can I, Amanda, or what can I, Mayor Chamberlain, do when I'm out and about to limit any exposure that I might give to somebody else of an illness I might be carrying that I'm unaware of, right?
Can we talk about that a little bit, Amanda? Let's get down on that one, because I think there's a lot of confusion about that, because we get a lot of pushback that says, well, why am I wearing a mask? I don't have symptoms. But those really play to that asymptomatic person, right?
Absolutely. So I'll just use myself as an example. So I am an essential worker. I am, going to work every day, and I am wearing a mask when I leave the house. It's not necessarily for my protection. It is for the protection of those around me. If I am carrying the virus and I don't know that I have it, I do not want to spread it to others by touching my face and then touching a surface where the virus might live. After I've touched that surface, I do not want to cough and have those particles be in the air and expose somebody else. So when I wear a mask, I'm wearing a mask to protect everyone around me. So it's more of a this is for the common good type of argument, and less about I'm wearing this mask to protect myself. So I always think about if we have the most fragile members of our community, right? Grandma or a elderly relative that is much more likely to need to be in the hospital and much more likely to die of COVID-19. I'm putting that mask on to keep those around me and most vulnerable safe.
And as you've run into through this process, those asymptomatic carriers, is there a time frame just to give people an idea of is asymptomatic forever? Like you could have it and heal and never have known? And if so, what's that period of time where you might be able to contaminate or spread?
Yeah, that's a great question. So the incubation period from everything that we continue to read and all of the guidance that we continue to receive is 2 to 14 days. The tricky thing is we don't have a clear handle on the antibodies and the antibody testing. I know that's been a big topic that people have been asking a lot about. So we can reasonably assume at this time that if I'm exposed, it'll take 2 to 14 days for that illness to incubate in my system. And then once it's incubated and I'm possibly spreading it, whether I know it or not, then there's that period of time after the fact, right? So if someone is symptomatic and we do know that they are carrying COVID-19 or they've been tested and confirmed positive, then the minimum amount of time that they need to stay home is 10 days, right? And then after those 10 days, if they were running a fever, we're watching for the fever to break for a full 3 days without using any fever reducing medication before somebody would be allowed to, return to work if they're an essential worker or be out and about. So we're talking about, weeks here that someone would need to be very, very careful. So if I'm asymptomatic, but I'm carrying it and I'm wearing a mask, then I'm definitely reducing the exposure to everyone around me.
Thank you.
Welcome.
Mayor, I want to give you a chance to know if you want to jump in at all with a question or a comment.
Well, from the very beginning, and I expressed this in our little conversation prior to this, this is a health issue. And I've looked at what the city's role in this is to support the health department and protecting the health of our citizens. At the same time, it has become an economic issue of great magnitude. And so the ability to try to find ways for our small businesses to continue to do business is very important at this point in time. Our larger businesses have either received some kind of aid or they've laid off people and people are on unemployment and the 600 plusing thing is in effect. People wonder when they see grocery stores and big box stores all open, and little guys are just, sitting there going, what's going to happen to us? Now, I will give great kudos to a large part of the small business community in Belvidere. They've reinvented themselves and found a way to do business curbside. And our fast food restaurants are doing volume that they've never seen before. When you see those things happening, we're trying to get a handle right now on what the economic impact really is and is there help available and will it come in time, et cetera. But the first and foremost concern of the city of Belvidere and of me is that we protect the people who are most vulnerable from this and not have this be a thing that rolls on and on and on. So I think that there's something that needs to be looked at is if we ask 65-year-old and older people who are not essential workers to stay home and people with underlying conditions stay home, could that be the rest of us who are healthy or not in essential positions? Could we get back to work? And I think that there is a thought pattern there that has to be examined because we got people on both sides and it's becoming fashionable almost, unfortunately, to flaunt the guidelines a little bit. And I'm not real crazy about seeing that happen.
As a follow-up to that, Amanda, not to put you on the spot, but maybe your fortune teller hat here, going into phase 3, it looks like people may be able to get haircuts again. So one, I wanted you to comment on the safety factor there and should people be concerned about that? And then fast forwarding months ahead, we know that we probably will not have a vaccine. We will still have coronavirus. Even if for some reason we did have a vaccine, there's never a vaccine that's 100% effective, nor does everybody get vaccinated. So as we look towards the end of summer, school, things like that, I mean, what do you foresee based off what we're experiencing now? Will there be concerns or danger with opening schools in the fall? And, should people be concerned about, opening up of the economy in some ways, like I mentioned, haircuts and things like that?
Well, I would be a very happy camper on this rainy Monday morning if I could get a crystal ball and a haircut. that would be like Christmas in May. Just wanted to say that. So this is a question that we're getting a lot, that I'm getting a lot directed at me, as the administrator of the local health department, that we're getting on our COVID-19 information line. People are emailing us. It's a reasonable question, and I just don't think we have a very good answer. I know that Restore Illinois talked a little bit about some of the measures that would occur to make us have to take steps back to a previous phase, which I think none of us want to hear and none of us want to have to do, which is why I'm a little bit cautious about moving forward to a new phase and making sure that we really, really legitimately are ready to be in that phase, because I think it's not advisable for us to advance too quickly and then have a spike or a surge and then have to take a step back. Just to clarify the vaccine situation and exposing people to COVID-19, that's been a tricky thing to address as well. So we as a general population will all be exposed to COVID-19 at some point in the future. The reasons for staying home right now are really to protect and assist our essential workers, to make sure that they can get their work done safely, and to make sure that we do not overwhelm the hospitals to the point where we can't care for the people that need that ICU bed or that ventilator. So that's that famous language, right? Flattening the curve that we just keep hearing about. It has less to do about, well, let's keep as many of the US population from getting COVID-19 as possible, that's not realistic. Everybody's going to be exposed to it at some point because it's completely widespread at this point. But can we, while we don't have a vaccine and while we don't have plans in place and measures in place to protect our most vulnerable, staying home and social distancing has been our only tactic, right? And again, it's hard to measure how well we've flattened that because our data comes in late, right? We have a little bit of a lag, and it's hard to measure how effective prevention strategies have been because, like I said, we can't put a number on how many lives have we saved, how many residents at a facility have we protected, how many staff would have gotten sick if public health hadn't stepped in, right? So as far as getting a haircut, it's my understanding that barbershops and hair salons and facilities like that do have options to open with limited operations and PPE and social distancing put into place as much as possible during phase 3 and 4, which I think would be a great step in the right direction. I'd like to see us follow the guidance as much as possible because I don't want to see us have to take 2 steps forward and then 8 steps back. I think that will be not only detrimental to the health and safety and wellness of our residents, but also very discouraging for people who have been working very hard over the last 8 weeks to make a difference, to feel that we would then really rewind the clock back to where we were before March 16th, 17th. That just sounds like it would not be good. So I think hair salons will be able to open during phase 3 and 4. I think that some of that will happen this summer, hopefully earlier, sooner rather than later. But I just want to make sure that we kind of work on this together as a community, right?
Well, I appreciate that. I want to give everybody, we're kind of getting towards the end of our time, but I wanted to, well, one, Laura from my office will put up information as far as testing sites and what's available, and then also contact information. Can members of the public contact your office with questions about COVID and other related matters?
Absolutely. So we have a COVID-19 information email line, and then we have a COVID-19 informational phone line that we encourage members of the public to call and email. We would ask them to be patient as the volume of calls and emails is quite large. It's hard for us to answer everybody in real time, so we ask people to leave a message or to shoot an email to us and know that we will work very hard to get back to them. Some additional resources that I provided to your office representative was a text alert system through the state health department that residents can sign up for to get accurate and up-to-date information. There's also a mental health text and phone line that I think is really good for residents right now, because I know that this is very taxing on people's mental health, being home, being financially strapped, possibly being laid off, worrying about the future of families and children and what's to come. So there's a good resource available for Illinois residents through that source, which is available to your office. And absolutely, people can call us with questions and concerns that they have.
All right, Mayor, Representative Keicher, would either of you want to make any closing comments or talk about anything that we might have missed?
I would certainly say,
otherwise you're out of luck.
Yeah, Amanda, I greatly appreciate. Please share with your team and the folks that you're talking to. We greatly appreciate all the work that you're doing, all the tireless hours. I can't imagine the number of times during an evening you guys wake up thinking about the next day's battle that you got to fight. So from the bottom of my heart, thank you very much for all you're doing. It's greatly appreciated. Please let us know how we can continue to share information with our constituents, and we'll be happy to do so.
Great, thank you very much. I think this is a great idea, doing activities such as this, and I know that with Mayor Chamberlain, we've done some on-camera recordings and interviews. I think getting accurate and timely information out to the public is extremely important, and we all have to work together on this. I think governmental silos are unfortunate and have been unfortunate. They become even more, they come more to light, I think, during crisis situations. And I think we also have an excellent opportunity to break some of those silos down by doing these types of activities. So I appreciate being invited to participate in this.
Mayor, any last minute thoughts?
Yeah, a couple of things. First of all, I think these calls are a good idea. We've been trying to do some innovative things with Channel 20 on Comcast and on our YouTube location. I just want to thank all of you. This is something none of us have ever experienced before, and it's a huge learning curve. and there are a lot of different opinions about a lot of different things. And I think it behooves leadership to take a deep breath every day and be thankful that we have a team of folks like we have working together, and we will get through all of this. Thank you all for what you do, and we need to keep questing and find the better answers for what we already know and try to help everybody that's trapped in this situation to be the best they can be. So thank you very much.
Agreed. Well, thanks so much, everybody. Have a great day, and thanks for all that you're doing. Take care.
Thank you.
very much.
Bye for now.
All right. Have a great day.